Hello, it's Dr. Lewerenz, the Longevity Health Institute here in Rochester Hills, Michigan. Wrapping up my day and got the official white coat on today. I forgot my sport coat. It's not really my style, so but everybody's saying, God, you look so sterile and so formal. And I'm like, well, believe it or not, I'm a real doctor. So, but listen, I wanted to talk to you about a couple cases this week. Interesting stuff because it really kind of tells you about the really important part and robust part of your gut health. And you've heard me in many videos in that, but I want to give you some stories here because how like impactful this is and how restoring your gut microbiome and your gut health. And more than that is building the integrity of your gut lining, fixing the border, fixing the boundary between your digestive system, whether that's your stomach, small bowel, colon, and your lymphatics and blood, and really has a huge impact on your immune system. And I mean immune system from anything from cancer to colds to viruses to COVID to flu, you name it, okay? Besides the fact, and I'm just gonna reference a few things here from the New England Journal of Medicine, and it's a republication, one of these about actually gut microbiome and mood disorder. And this was a publication that was, like I said, republished in the Science Advisory, December 2020, about how the microbiome is linked to depression and how the improvement of your gut health can improve your mood. And I will tell you and preach this for years about when we see patients, when they come in for mood, we evaluate their neurotransmitters, their hormones, but absolutely no holds barred. We dive deep into their gut health and make sure that their digestive flora is well. They're getting the right nutrients. We're building the right flora, getting rid of yeast and candida and maybe other microbes and parasites. But I'm telling you, it can restore their brain and brain function. And, even the psychiatrist that's world-renowned, Dr. Amen, will preach and tell you, because from his Amen clinics and his SPECT scans and all this, is that you can drastically improve inflammation related to the brain and mood related to the brain and prevent even cognitive decline when you improve and fix somebody's digestive lining. And that's what we do here in our clinics. So that's a big thing. The other thing is that I wanted to stress to you, besides these few cases that I'm going to mention, is that there is, and I'm going to talk about in another video coming up here, there is a pre-publication and there is some information out there and being circulated in the medical world about there's an uptick in COVID-19 deaths and hospitalizations in people that were found to be on PPIs. So proton pump inhibitors like omeprazole, Prilosec, Prevacid, Nexium, any of these PPI drugs, which you are on. I know out there you're on them because I see you guys all the time. And they're Band-Aids. They're Band-Aids to a wound at the digestive lining. And they Band-Aid and kind of take down your acid, if you will, which is not a good thing and has its purpose to be there to break down and absorb and digest food and create less inflammatory responses at the gut level, besides the fact that that's the only way that you get your nutrients. But the thing is that the association was about a 24% uptick in hospitalizations and mortality with COVID-19 when patients were on this. Now, they're going to research and look into this further and I think broaden the study, okay, and broaden the meta-analysis and the data of this. And I think that we're going to hear more and more about it. But I think some of the message that might be getting missed. It's not the PPIs that are the problem. PPIs are not causing worse than COVID-19, okay, or hospitalizations or death. What's happening is that it's being anecdotal that these patients that have bad guts they have bad immune systems, and then they get hit with a virus like COVID-19 or any virus, okay, the flu or anything, and they're going to have a more profound effect. That cytokine storm, that viral load, that where some of us get hit and get worse, okay, and others don't, could have a significant impact when you talk about gut flora, okay? I firmly believe that because of one story I'm just about to tell you. I had a new patient here in Rochester Hills, and she was referred through a pastor that refers to some patients in the community. Great guy, really does some wonderful stuff in the Oakland County community. And long story short, said, hey, you got to see Dr. Lewerenz because he's going to dive deeper because you have some really strange stuff. And she had been to U of M. She had been to several immunologists and actually many internists in that, okay, who did all good stuff and good workups, but there was a simple foundational system missed, and that was her gut health. Here's her story. 2 years ago, approximately, she had a flu vaccine and got horribly sick with the flu vaccine and never said she'd have one. Well, then COVID comes. And she, in this last, I think December or January, said, well, you know, maybe I should get the flu vaccine just to be safe because of COVID and etc. So she gets the flu vaccine, gets horribly sick for a few weeks. Then in the next several weeks, gets COVID. And when she gets COVID, she is actually has a fever for 49 days. Very specific. She wrote down her whole history for me of symptoms and fever and how many hospital visits she had and etc. And really nobody could answer why she had this. Now, she didn't test positive initially for COVID, later did. But long story short, she had this long-going febrile effect, chills, aches, fatigue, tired for 49 days, okay? And no one else in her house got sick. No one else, her exposure that she knew. She literally had to stop working for about a month and a half. And then eventually it started to fade, but she's now achy, still tired, no fever, but she's got this kind of inflammatory response, some swelling, some chronic lymphadenopathy. But anyway, here's what we unraveled in one visit here. So we looked at her blood, and we drew some blood, and we looked at her urine. And then I did an evaluation on her live blood in front of her on the screen, and I have other videos on this. So this tells me a lot. Now, it's just a visual tutorial. I do the labs, I do stool tests, etc. But this really showed us in one visit, okay, whoa, you have a huge, huge, huge immune effect at the gut level. So, of course, in her story, in her history, for 20 plus years, she's had IBS, she's taken chronic Tums, she's taken, PPIs, she's taken omeprazole, all that stuff over the counter, Rolaids, you name it. She's always dealt with food sensitivities and IBS and all this stuff. She's had a bad gut. She has a bad immune system, okay? And she's just tolerated it because nobody's got to the root cause. I firmly believe this is not anecdotal. It's why she got hit so hard with flu vaccines, so hard with COVID. I've seen this before. And this is what's going to happen with her is she's got this huge, huge, huge antibody response, huge inflammatory response. Her labs came back just the other day. She's got high CRP, high interleukin-6, okay, high SED rates, okay? And these are very common when we see somebody that has this big inflammatory immune response. So anyway, back to the story is we'll get her well, but we're going to get her well simply by fixing her digestive lining. Her antibodies, inflammation, and immunity will come down, okay? And I think she'll do wonderful. But it's going to take some work at the digestive level. So you want a good immune system, you got to build a good gut flora and microbiome. You want good mood, just like published here in New England Journal of Medicine. You want to have good gut, good diet, good nutrient absorption, etc. And that's what we do here at Longevity Health Institute. The other thing is this, and this is more sad. About 2 weeks ago, I saw a new patient to do some integrative alternative therapy with him, with his oncologist for his esophageal cancer. Very sadly, he's had 20 plus years of taking antacids and taking Rolaids and taking over-the-counter medications for his heartburn. It caused esophageal inflammation and damage and then changed those cells, those columnar cells, to cancerous cells. No question, full association, no doubt. So he has esophageal cancer now, and now we're having to rebuild that and help him fight that with the oncologists. So you not only are building your immune system, but you're also helping prevent cancer besides other infections and things like this and inflammation in the body, etc. So you can't rely on, hey, a Band-Aid for a digestive problem, okay? You got to get real with your gut, and you got to fix the digestive lining if you want to live well and thrive. That's my story. So this is Dr. Lewerenz. Hopefully this keeps on informing you, enlightening you, educating you, bringing you good knowledge and sharing with others, loved ones around the world and country. do some consults, believe it or not, now out of the country, in other states for sure. But hey, we're always open for business and have other practitioners and myself doing wonderful things for you with passion and care, with your best interest at heart, because we love what we do, bottom line. So this is Dr. Lewerenz. Hope this finds you well and informs you even better. Be well.